sermon. Man of God, you don't lost sermon. You don't get topic for talk again. But the truth is, this is where this is how far the country in him don't go. This is how far the Kush talk don't spread. And this is how widely spread this talk here so don't go. Well, today, una can for say with me on show them they be a bit different. Sometimes I go full on, other times we dey take with them and break things down and look at them piecemeal. Today not to the day where we go get for take with them for look at things piecemeal. We go okay, something just happened here. Give me a second, people. Today not only term because when I can do this show, I can then have other platforms them as well where we they broadcast from for see waiting they happen and see waiting they go on. And or maybe the interactions them I can pick 2-3 comments from there. So that they just happen right now. I mean then at the the YouTube platform and it just appear for just go off. Right, so then they distracted me a little bit. However, make we not give up. I know I just saying I just a technical glitch, and that everything will be fine. And it could have also just been a technical glitch from my end, or maybe a reset on the other side. Who knows? But at the end of the day. Kush, this drug addiction, yeah, so na big problem inside we nation. And for me, certain things then they go on even right now as I talk so inside salon way. As important as they are, right now, that enough for be with focus. For me, they are distractions. They are distractions. One of them distractions then they now the co-chairing of the Chief Minister David Senge in WEF to one of we national monuments then at Salone. They are in the Miata Conference Center where they want sit down for rebrand, right, as the new Miata, I think, cultural center or something like that. We go get to that day because for me, I see a lot of people in Canada, they then vent their frustration and saying, okay, nobody not in a salon where get the knowledge, we cultural knowledge, we not get cultural gurus them and bearers of we custom, traditions and norms them for pass them on. And Chief Minister in WEF now go able to steer the ship. We get educators then, we get historians then our community, we get cultural literates them now we community, we get poets them, we get people where they write how you call them the subject I work in taking at school, English literature. So literature, right? And we get all the one and day. We country full of so much wealth and knowledge. And then you now wonder why somebody where na married kind size salon, no born a salon, no get any foundational knowledge like that, steep into we culture and we tradition for make income coach or something like that day. Some good then day where if even somebody put on you and he tell you say take me, they say no, thank you very much, but no thank you. For me, this instance here, so now one instance where, yes, she dances, yes, Kate, the chief minister, where yes, they dance, men they dance. Yes, they talk Mende to some extent, because I don't know how fully fluent she is in Mende. Yes, he don't take artists them go different shows them internationally and don't bring them come back. Yes, where Iman been there America in the house Sierra Leoneans them. We all they do that. Not only Sierra Leoneans them, people from different nationality, different background. We all they do that. Like me, so I don't take in Ghanaian Namios for free. I don't take in Nigerian Namios for free. I don't take in Sierra Leoneans them many times for free. I don't even take wait people in Namios for free. So being caring not mean for say that care they now for translate to something else. As we did go along in one of the shows, I will find time for address that day. Because this is where the term apathy is boring, or the use of the phrase apathy is boring. This now apathy now they happen so. And waiting me call a complete disregard and disrespect for towards the Sierra Leonean people then. And the people when they say, oh well, she's volunteering her time, blah 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 blah. Did you approach other Sierra Leoneans then? Did you approach Sierra Leoneans them? We don't drink, eat, sleep Sierra Leone. We don't promote Sierra Leone all over the globe. Did you approach them? Did you approach the custodians of we traditions and we history for understand them? Just because a woman they talk Mende or somebody we married into another how you might call it another nationality happen for speak the language or happen for get some form of interest in the culture, not make a custodian of that culture there, not make the master sabi person. Sometimes we embarrass ourselves and allow others to embarrass us by our own actions. So the outrage of that day, whose I don't go right now. Because as far as I'm concerned, when I read, after all of the backlash, when I read what she said, she wasn't backing down, she wasn't stepping down. At the end of the day, what he say, he call una for say, make una join on with him for push the work go before. Because for her, he say in a noise, the complaint or the grievance na noise. And for me, on a different note, not to her, but on a different note, that setup day of that how they call it, no advisory committee or whatever it is that they call it, for me it's a distraction. Because we have a much bigger issue on our plates to fight. And very soon I will understand who side they go with this and why I open with this. We get a much bigger issue for Fetna with society. We get a much bigger issue for Fetna Salone. Okay, so you dey reform culture, you dey reform tradition, you dey reform the civic space for who? For who? If you not take care of your young, if you don't take care of your youth, if you not take care of your developing population, and that you allow them for perish through the hands of drugs, who are you reviving the civic space for? Who are you reviving the cultural space for? Who is going to benefit from your resurrection or your restructuring? Who is going to benefit from it? Because if the demographic we're supposed for benefit, where you supposed to pass the mantle to, and then take her now, and then pass the mantle on to the generation that comes after them. If that generation is not being properly cared for, not being properly catered to and catered for, why are you wasting money, energy, and resources on futilities? Because now that name called futilities. What do you waste energy and resources on futilities when there are much more bigger fish to fry? Yes, a married Ghana man. Me na Sierra Leonean. For all intents and purposes, one of the predominant languages in Ghana na Tree. Yes, I dey talk Tree. Mr. Congo Sami na Tree. Na that time they go know the level at which I dey talk. Me man na Ewe. I dey talk Ewe. I dey talk Ewe like how I dey drink water. I dey understand Ewe like how I dey drink water. But does that make me now say because I sabi dance akpacha wey na dem traditional dance, right? I sabi dance the Edinka wey na dem cultural dance for the Tree and the Ashanti people them. I know the signs them. I know the dance moves them. I know the steps them. I know the meaning to the songs them. Both secular, gospel, traditional column. When then they do their course, I know what that means. Does that make me now custodian of the Ghanaian culture? You feel to say me, Matilda, then go ask me come on at this Canada, so then go put me inside Ghana, inside all the big name them. We don't work so hard for put them country their image go before. Then go take me, little Ange from Sierra Leone, because I happen to be married to, and go sit me na the council of restructuring of reform in na the culture and tradition and in civic space. You think they will stoop that low? And if even self for 1 second, one battery loose, you feel to say me in my right sense and mind, me go put me face and me foot inside, and they no matter if na that space they self at the walk. Sometimes we need to respect people, even when they themselves, they do not understand the value and the worth of themselves or their people. Even when they themselves, they may not understand the value or the worth of their people, we ought to respect them. Sometimes we walk away. Sometimes we walk away. And for kids now, then they maybe they expect say for do. Because we know we take now this business of nepotism, this business of I'm married to, this business of affiliation, and smear them in every corner and facet of our society. And yet we say we are looking for a transformed nation. How are we doing? Like, what rules are we setting now this game of transformation? But like I say, I will get for come back to that properly. One of them days here, so one of them Saturdays there, so. And for we viewers and listeners, then last week I tell una say, we go through the government's the initial approach where them don't put or steps them where them don't put align saying and then get for use for combat this drug addiction. This week uno see outside the president gonna different hospital them and the rehab centers them. They had to open them on an emergency basis because water don't pass the flour. The water be don't pass the gari, be don't pass the flour. the poto poto self been done they turn fire now, you know. And so in this pressing time, okay, so una see usai he address people there, address the victims them, and they do a nationwide tour, as a matter of fact, going to different provinces them, talking about the Kush and what have you, and then get a state engagement. Now this would be the second state engagement, right? The first one have been to money. I don't know if Boko of have been followed, and they where them in call them a national conversation. Have been to money. Like I say, my organization where me they hand and glove with, and where now the music we can open, we been they hand and foot, hand and glove. There's a lot I can tell you, but I withhold, and I'll continue to withhold. And so now we're at this junction where we are having a second engagement. I think say before we even forget the second engagement, I think what the president should have done was to call those whom he had entrusted, who he had entrusted the task of the first engagement for, say Alpha. And this have been put now on our hand. Unu can report back now. When we been begin to gather and I also have been tell we say we dey usai we dey now. Having a good perspective and having a good evaluation of where we are now would forge and frame the discussion and the steps needed to be taken for usai we need for go. And so, even in the midst of this, I see Sierra Leoneans them in the last 2 weeks were so furious talking about drugs. Even the one themselves we not affect. We been the talk say you know Matilda, you do so now on this drug business. Then self join and then begin talk about this drug business. But have you people noticed the shift? In the last week and a half, there has been a shift. I don't know if you people study the media spaces to understand what is going on. There has been a shift because a lot of distractions don't coincide. Now Sierra Leoneans are busy wasting their money instead of putting their resources to help combat this addiction, to help wash out this menace now in society. Now then they put their money on a game called Housemate Salone. No offense to the businessman, no offense to Navo, Junior Navo and in Housemate Salone show, but the question I'll ask is this the right time to be putting young people who they themselves has demonstrated a high level of mental fragrance and mental defragmentation? Cause na that day I go call them. Me not get time for sit down watch them kind show them day. My life is busy, my life is packed. 24 hours self not do for me. If God could have created, or if mankind could have developed, a chronological system that is more than 24 hours, I think say me na one of the first person will go put me up for vote and say yes, let's do this. Because me life so full, me life so busy that I don't get time for waste me brain cells them where for the use for put into something better for either where I am in Canada or uplift myself and make myself a better person, or invest some of that time to doing something in Sierra Leone and making sure our people are good. And so you bring another distraction now, and Sierra Leoneans then we are so quick to be distracted. And so you see the people in the diaspora as well as those back home more so supported by the diasporan community all their attention has now been shifted away from this very important discussion and menace now a society when a drug addiction to full-grown men and women insulting themselves on international in the international stage, because according to wetin I understand, I take them for us, they say yes, the show they show na salon, but you can access it internationally. So on top of this menace called the drug crisis and mental addiction where we get, when I go put big people them na national television where they project internationally, we not get the composure, we not get decency and composure, forget adult conversation or for engage in adult arguments. But instead, all they can do now for they use invective upon invective upon invective, so many cause, so cause. Man, or they go against the rules, women are going against the rules, all kind mix up, box up, and according to what I was made to understand, it got so bad that then get for bringing the specialist where I don't get na this show ya, so Dr. Carola Labor for go na the place there outside and they host the show and talk to the contestants them about mental health. I think that should have been done. That should have been part of the screening even before they enter inside the show. Because we are a society needing recalibration. We are a society that has not dealt with the ills that will happen to we yet. The blood, the DNA of some of them bad thing, and they still they run now within them, and we not get a nationwide discussion and plan on how to address them thing they are so yet. The recommendations in the TLC report have not been addressed insofar as tackling the residue of them traumas then they. And then you put them people and they inside a situation of stress. What did you think they were going to exhibit? Obviously, then go exhibit them colonels. The mental state don't demonstrate say we are a people that needs help. And so from a week of this person, the body them, the this, the that to a week of publicly disgracing our identity internationally. To the point where they get for bring in the mental health expert who can talk to them. Do you think one sitting down and one sessions with this contestant is going to do jack? These people are damaged. Damaged from different angles then. And not a one-day thing. It's not a one-day restoration. It's not a one-day pep talk towards restoration. Now that make I consider, I can laugh with some people and they say, yeah, we want to do a drug addiction. Do you understand what drug addiction is? We are open rehab. Do you understand what goes into a rehab facilitation? A rehabilitation? Una know what's in a rehabilitation? Una know what's involved in proper rehabilitation? I want to tell Dr. Jallo, thank you, because at least from what I've read and what I've seen, he has done his best to follow international standard. But as we all know, they say money no dey. The man not go kill himself. He's not going to squeeze water out of stone when there is no waterfalls, running the water through. Make we look at the 5 approaches them of government. And by the way, I go get for say sorry to una all. The show not will go up to 7 o'clock today because I get a prior engagement where, as a matter of fact, I for don't dey na road now they go na that engagement day. But I made a promise to you guys that whenever such situation arises, if I can squeeze, if even self now 1 hour and delay my appointment by 1 hour and can't talk to, and I go do that. And that is what I'm doing today. Next week, absolutely, we go sit down and look at the national or the state engagement where the president gets na state house. We go listen to wetin people and get for say step by step, and we go analyze them because, like I say, this fight is not only our fight; it's a collective fight. And so therefore, even before I begin going inside this, I want to take a moment for acknowledge some of the beautiful people and way Hope for Youth they work with na Salone. I want to acknowledge the Hope for Youth Kailaun district. I want also acknowledge Hope for Youth Bombali district. I want to acknowledge, as a matter of fact, the LUC na Kailaun. We team up with the Hope for Youth members them na Kailaun during a soccer tournament, a soccer match. We come and talk about the dangers of Kush. Talk about how, as a community, na Kailaun, as a province, they need for rally around each other, for help each other, for stomp this drug situation common at them province and na them different communities them. That is the type of partnership we need. That is the type of partnership Hope for Youth has been working on and consistently working on over the past 5 years. We've never stopped and we're not about to stop. And I want to tell the Makituman and Tenki na Bombali na Makini. I want to tell for their cooperation. Then can then go listen to waiting the youth then get for say, allow them into their spaces, talk to them, something that they not to pass, you put boku money inside. Sometimes it's your approach, the way you approach. Sometimes it's your tone, the way you talk to people. And then they make somebody be receptive to your message or be averse to it. Yeah. So next week, like I say, that press conference it wasn't a press conference, it was an engagement where the president will a state house with different stakeholders. Then we go do piecemeal. Before I read the President's Bureau 5-part strategy for a drug-free Sierra Leone, where then they've been done, as a matter of fact, I think that was this 5-step approach was birthed right after Bintu Mani. Right after Bintu Mani, that 10 day then they happen. But one thing I want to say about this actually, let me finish this and then I'll come back and say that way there's cohesion in what I'm saying. Let me go back and do the 5-step approach, because next week we go sit down look at the effectiveness of this 5-step approach. Was there something missing? Should there have been a larger discussion on before even then? I know for say this now I can call them and you can say 4th step, right? You get your 4th step and then you get your sub, right? And so someone will be like, but Matilda, this is just overarching, we're not going to the granular. That's fine, I understand it, but even in this 5-step there could have been something that was missed. Make we look at the 5-step again. Okay, I'm just waiting for it to be made a bit bigger so I'm able to read. Thank you. Okay, so President's Bill 5-part strategy for drug-free Sierra Leone is say prevention. So on the prevention end, they said this include awareness campaign, promoting health or healthy alternatives, and deterring drug use. Now that day nine we they do that part day, right? Like our organization like this, Hope for Youth Sierra Leone, we've been doing awareness campaign and sensitization, promoting healthy alternatives, right? We get zero tolerance to drugs, so we not even they promote an alternative. For us, it's drug is bad, it's bad, that's it, right? Not take them, not do them, not attempt them, that's it. And then in second, the second part now, care and treatment. In every district, we will establish accessible treatment centers that are adequately staffed by trained professionals to offer care and support to people with drug addiction. That was the intent. That didn't have been the intent, but however, not all that they happen. Because we know for say, from where Bintu Mani happened, since Bintu Mani happened, right? I believe say Bintu Mani happened in 2024. Since Bintu Mani happened in 2025, we'll go back and check for be sure if Bintu Mani had been 2024, it happened or 2023. However, because I know say the vice president been there, as a matter of fact, na him chair Bintu Mani, I am tempted to say Bintu Mani happened shortly after the election. That's what I'm tempted to say. So we know for sure say na 2 treatment centers the normal we get. 2 treatment centers the normal we get. The one at Dau, when na up north, not ever open. We know say we get one at Bo, we get one at Hastings. But we also know for say since June, we know for say then 2 treatment centers then they self will be open. That they mean they take people them by installment depending on the availability of funds. And where funds not there, they not they take people then. And we also know that since June, right, since June of this, I've been getting the date. I don't know if I've been since June of 2024 or June of 2025. I want to make sure I get it accurate. But what we know is since June, health centers then they are non-operational. Patients they not been there, the domots them been locked. They cannot take in patients because they not been get funds then. The people them were responsible, where them put in charge for do the work, then self open them out talk them. So this is not about Matilda saying. So basically what we are saying is that the intention was right, it was there, but the execution, the delivery, it not happen like I supposed to happen. We go come back and talk about that and we will talk about how we could have utilized existing clinics or existing hospitals within the province system for create a unit, if even temporary, for create a unit where that unit then they dedicated to the intake, inflow and outflow of drug addicted patients. Because sometimes you not get for wait until you get all thing before you begin something. Sometimes you look around and then you make use of waiting you get available until you can get to a point where you have what you need to you know to do what you had originally set out to do, right? Now the third part now, social services support to provide comprehensive recovery services such as counseling, skills training, and reintegration program. Okay. Some part of this, them been doing na Hastings and Abo. Some other parts, they not be able to do them because they not get the resources, neither they not get the skill sets them for be able for do them. We will go into that. This now na government too. I know they talk about the private institution because there are private run computable one. I know they talk about Mami Sampa or Pam Mamodu in room. Then he say this one also I just need for shake cola no more or throw away water na gone. It dey well. Not to the end and they talk, but I dey talk about medically supervised private run hospitals then. They were successful at it because swamp and the person way sit down na table inside this state engagement. Jaden Ken na been a heavily drug user. I be a drug addict, period. Instead of telling story, you go know say I be a drug, no kind drug, no the way Jaden Ken no use. Now, if you're familiar with the name of Jaden Ken, last week I talked na I also say, you know say the young people the way be one stage this protest against drug abuse and awareness. You the government to not sabi them. You the government, you know who side and they. You the government can access them. You the government know for saying that inside salon and they know they run go outside. Well, guess who that person was? It was Jaden Ken. It was Jaden Ken that was the lead organizer. Jaden Ken, I will tell you a little bit more about his story, right? And how he become hooked and addicted to drug. But one thing where I'm glad for see at least now the State House engagement, now the fact that say I see Jaden Ken was part of the table. He was seated at the table, he was given space at the table, he told his story, and hopefully it was heard. Now, according to he say after the protests, this, that, not work, the chief minister reached out to him. And after he talked with a lengthy discussion with the chief minister called status and tell Kekom Thomas say, whatever you do, make sure say Jaden Ken sit down at that table day. Now the status engagement with the president. So that was a good thing because Jaden Ken has a story. He's got a story to tell. Yes, not in the medical field, but he understands. He understands the pathology towards drug addiction and the steps out of drug addiction because you don't go through them from A to Z. And now he's become a champion and an advocate. So now be one person now the way me being glad if you see sit down at that table day. Because these are the people that needs to be at the table where you they talk about such things. Now the fourth, I think that was the third pillar. The fourth pillar, law enforcement. We will dismantle the drug supply chain through investigations, arrest, and prosecution. Well, I'm sorry to say we haven't really seen the effect of that. We have not really seen the effect of that. If indeed the said Yosh Lidecker, Umar Sharif, who una say una they prosecute and una they look for, Unu not provide we updated of wetin unu don do with Umar Sharif. If indeed Umar Sharif was said to have been in our country, and Umar Sharif now one of the notorious drug lords them around the world, I think say one of the boldest steps that we could have taken as a government is the arrest of Umar Sharif of Yoshilai Deka. Public display of his arrest and prosecution. I think say Dande for don't give the people of Sierra Leone a little bit of hope and credibility in what you are saying. Secondly, if the so-called ambassador, was it the ambassador to Guinea, where them fen drug there, na the motoka, right? Na a state-owned motoka, right? Unu say unu dey investigate. What has become of that investigation? Can we have an update of that investigation? Where are things with that investigation? These are some of the steps where if you take them step there, so then una they bring back some form of assurance to the public for say, we are not just blowing smoke. We are actually serious about what we want to do. We are actually serious about dismantling drug, the supply chain. We are actually serious about investigation. We are actually serious about arrest. We are actually serious about prosecution. There are few more names that I will get into, including that salon musician. Me don't forget wetin I be name. What have become of all of those? We need updates. You need for carry the people along. Because you cannot just say this is a fight. This is everybody's fight. Everybody and for day inside. Everybody for put on. But yet, you refuse to carry the people along on people that, you know, people that we don't raise suspicion. Or people then where we don't get some form of evidence, say they hand up on something. This cannot be a secret thing anymore. It has to be treated in the open with all sincerity, honesty, and truth. And then when I go to community engagement, well, someone like Jaden King, someone like Hope for Youth, they are your foot soldiers. Now, then people and they will need for collaborate with. You say partnering with communities will be crucial in our fight against Kush. That protest, where a match with Jaden Ken be one stage, had the police worked with him. So I don't understand. The chief minister they invite Jaden Ken to state out for can sit on a state engagement who side the very LUC we deny him the right for protest self-sidon they talking on. Self-sidon they talking on. Shouldn't they, and I keep repeating and I'll keep insisting, shouldn't the police have carved a way to work with this young man? Because if they talk about partnering with the communities, who do you think are the communities? The community na me and you. The communities are the young boys and girls from all over the whatever, is it 16 districts or 16 provinces of Sierra Leone where we they work with and beyond. The community are people like Jaden King. The community are people like myself sitting on a Saturday when I supposed for doing some kind of engagement right now. Still sit down and so they talk to me people then. That is the community. So I don't know how Uno define community in this sense. But maybe you might want to go back and sit down at the drawing board. When you they ask the people then, after being to money where you been entrust, you put on that and care say this work here so I put on our hand. Make them come back and make them can give you a report of wetin they don't do. And that way they maybe, just maybe, you go get chance for re-strategize, analyze, re-strategize and see wetin dey work and wetin no dey work. Wetin we for pull comot and wetin we for add. Or maybe there's nothing we need for pull comot. Maybe there are things, loopholes, there are areas we need to strengthen. Right? There are areas we need to strengthen. So I go keep go back to this 5-part strategy or 5-part approach by President Bio for a drug-free Sierra Leone. Even as we dey talk through this drug situation. Let me take some comments from our YouTube. And then we go listen to 2 or 3 videos then from Dr. Demby. And then I go left una with the state engagement as I bow out for today. And we pick it up piecemeal next week. So Peter Dauda na YouTube, they say, talking about drug addiction in Sierra Leone, it is the question of the user know the dealer and the dealer know the producer. Yes, I agree with you. We could talk about Dandy. And then Albert Lansana, greetings brothers and sisters. Greetings Albert. Matilda, good afternoon. Good afternoon to you too. Greetings, welcome again. Thank you. Now we have the problem in Sierra Leone are not just about money, but how and where they are spent. Absolutely, I agree with you. Where is the accountability in Sierra Leone? Good question, Peter Dauda. We all know each other very well in Sierra Leone. Absolutely, Abdul Sisese. If the government now admitted that Umar Sharif is Yosh and they have him all this time, they must give accounts of his diplomatic passport. APT should ask for info and the Internal Affairs Minister, Police. Listen, in this fight against drug and in this fight against mental health, drug addiction, they are big when I pull political party come on inside. Drug addiction, like I understand what you need to try for say, Abdullah Sharif, that the opposition should hold the ruling government to account. Right? The opposition should hold the ruling government to account. But if they fail to do so, we as citizens, ordinary citizens, now we right for hold the government to account. If the opposition fail for exercise, the reason we make, or one of the reasons we make, they are called opposition, and for speak for them people them, listen, we as a people, we have the right, because remember, the government ask we for vote for them, for serve we. We get the right for call the government and call the government to account. And in this particular fight, we cannot sit back and say you dey wait for opposition for take the lead on this. Because when the drug they victimize people them, you know they look party affiliation before you victimize. You know they look party affiliation before somebody becomes hooked to it. You know they look status at all. So the onus is upon each and every one of us for ensure say government state institutions do the right thing by the people. They're saying the information minister, internal affairs, should step down. Let it be a discussion for another day, my brother. Let it be a discussion for another day. Let us make we listen to waiting the Minister of Health, right? The Minister of Health. Some of what he been get for say, because we'll pick it back up next week. But what is also very, very important in this whole discussion is that we get now we hand right now a situation where the percentage of the budget within they allot to health in general, broken down by per capita, if you dey drink water you dey eat, you go choke. You go choke. Make we listen to some of wetin the minister get for say as we wrap up the session for today, because I tell una for say I get an engagement to I suppose for done dey on my way now. But this is also very important to me, and I belong you on my word. Make we listen to Minister Demby. This not only video will give full recognition to Truth Media, we na Lamrana, Truth Media, na den video, na den do this interview, and I will always say give credit to whom credit is due. I like the fact that it's the new thing on the block. The approach is different. They are willing to come sit with him and speak with him. And by proxy, we serve the benefits and able yeri from them, yeri waiting and get for say, so that when we talk, we are not talking based on assumption. Our analysis are based on what they are now saying and have to say. Okay, now listen.
The Port Local Hospital, now other one down there, we really, oh man, the Port Local Hospital, now gift from UAE, but not tent in a 100-bed tent field hospital during COVID-19 give it down there. So give it down there, the tent, then give 5 country them. So unfortunately in Salonia, the kind of rainfall all they get, that tends it not gonna last 1 or 2 rainy season. The mildew where they grew up on it's just huge. So what you decide for do, therefore build a whole accessory around them. We build a canopy where they catch all of the rainwater and redirect the rainwater. We don't build not complete yet, but 17 quarters for healthcare staff. The wall don't go up now, we need for roofer and finish them. Then get about 49 duplexes for staff. Then get a canteen, then get an administrative building, then get a warehouse, all of the process. All that even happen where we they raise that $50 the airport for COVID tax. But that money they don't dry now we had. The work not done. Waiting happen back again. Then give it the incentive, then give it 2 mega generator for run. 2 big generators, I think about 1 megawatt or something generator for run the tent. Because the tent inside hot. Yeah. If you not get this air conditioner, it not go work. Nobody not go say. But the design is really nice. You get 10 different cubicle and 10 bed each. All of the equipment and supply there. But what's happening now for able for connect the power. So they pan this Port Local then can lend one the generator. So that generator now they supply power to the whole of Port Local and during dry season, when they not use the Bankasonka dam. So now with this talk with EDSA, una they generate all this revenue, all what they ask for, though we get connection between we own generator, una don't lend for we, una they use make money pan, link them back to the hospital, so we will for open this place. That all with that normally only the staff ready we don't
so now power make the place not operational.
Well, now power make the place not operational. Again, not too small. We'll try to see if we can get solar solution in the short term. But then the generator big past is us. Yeah. If you watch the power,
but maybe somebody can pay for it, like you said, and they make money. Then
they can take it. In just extension, about maybe a kilometer or so, or half a kilometer, a cord for just can't supply the hospital. Would they left the generator given to them? So the person get this vision. So in fact, we try for translate and say not to the baby no more, not the mama, the baby, the toddler, till he go school, till he turn adult, till he turn senior citizen. Let's look at the whole life stages approach. So you get this, then once away the US, he meet with Paul Farman at MIT, Paul Farman at Harvard, me and Tom been on the walk all this while literally they Haiti, So
of the power station in Putloko and why make the 10th hospital where them been donate to Salone during the Ebola term not a work. Excuses. Me, I don't like where people they give me unnecessary excuses when I know there is a solution. First of all, why give EDSA a generator where then donate to a hospital if before you give EDSA the generator, you don't make EDSA, like you said, you just need an extension. You don't make EDSA, don't want that extension. They force from Potloko to wherever that 10th hospital is, that 100 bed 10th hospital is, so that the hospital is supplied power first. EDSA, then they there for make money. So while what is important, which is taking care of the people, taking care of your people, taking care of the sick, is being put on hold for the benefit of EDSA, where they make money na people they aid. If EDSA no one draw the power line, why charge EDSA a fee for the utilization of your machine? You say na length, then can length. What was the agreement of this length? They can lend something where supposed to be for the benefit of Sierra Leoneans then. This machine was given to Sierra Leone for the benefit of Sierra Leoneans then. Why una go make arrangements, take the generator, give EDSA, and then no mandate EDSA for make sure say EDSA make provision, adequate provision for power to be supplied and be constant at the 10th hospital, the 100 bed 10th hospital. So EDSA is making profit on the people's back and then denying the people access to health, because that's basically what that means. And you are co-signing on it, Mr. Minister, sir. At this point, that's what you are doing. You are co-signing on it. You co-sign on the death of people then. You co-sign on the ill treatment of people then. You co-sign on the people then where they get drug addicted, we're supposed to get treatment. You co-sign on their non-treatment. This is what this means. Because every little counts. And you talk about Moldu. Mr. Minister, you lived in this part of the world. You live in America and work in America for the longest time. You can't tell me, say, you don't know, say, treatment the way they spray na that 10th day for avoid and prevent the moldu. You want tell me say we're not toxic or harmful to mortal man, and at best safe you can even evacuate the hospital for 24 hours, make them spray the tents for prevent mold, and in the event they see any mold, 1 cup bleach to 2 cup water. 1 cup bleach to 2 cup water, or 1 cup bleach to 5 cup water. You soak them, you then wear them gloves, then wipe them. It pull the mold comot. It prevent. Why is it that little things that we can do for ourselves, we dey take and we make them so big like for saying a problem issue? We're not a problem issue, where there are very safe, quick fix solutions to them. Because this not a quick, me not then at the health sector, but I know say common sense and research tell me say there are products you can use for treat mold, for prevent mold. And if you not even afford them products, then we get bleach. We get bleach. Bleach is affordable, it's cheap, it's common. If even you pour one gallon bleach to 5 gallon water, that is enough for whip the waiting and call them for as a preventative treatment. Why we not go use the small things that we have around us to help us? Why do we always have to wait for the big things? Why? Good una build a canopy for protect the tent and divert the water because the rain heavy in a salon. You think say a salon no more than donate them canopies than they too? Not a salon are the only tropical place where they donate them canopies than they. Then donate the same canopies than a Ghana. Then donate the same canopies than a other country. Then why is it that they not complain? Then they make use of their own. They find ways for treat them, patients them. But we all time we get excuse upon excuse upon excuse upon excuse. Even the least minute things if we not cost $1 for fix, we dey wait for make donor can give we. Why? Why will not they find everyday solutions to our everyday problems? Because this was an everyday solution that it's needed for an everyday problem. Me not buy that. Some excuse them they are absolutely unacceptable, and this is one that is absolutely unacceptable. Absolutely unacceptable. I want to go to a comments then na YouTube. I go pick them up from Abdullah Sise in comment. We say absolutely, Matilda. The nation is waiting to hear the secrecy of and if that Yosh in okay, I don't know what you were trying to say there. Citizens should take all the drugs victim out on protest for the world to see how the government neglects us. Okay. The first part, I think I kind of understand what you're saying, but I don't want to assume, so I'll wait. Peter Dowda, they say everything about Sierra Leone is broken, but we are capable of creating a new society in our country. Absolutely, I agree with you. And then Abdullah Sisaya goes on to say, see how stupid talk this is. How come you own something without income? Yeah. You lend it to another institution and waiting for free. Exactly, my brother. Exactly. Now some of them here, so I don't know if they can think through the answer them when people ask them question before they begin answer. Because this is very irritating. And this is one of the most irritating response to a question being answered that I've heard in a very long time. How you go tell me for say then give you something for free? Okay, let's say something the thing is so powerful that the capacity, you don't need that kind for pull that kind power there. Then make best use of it. Make best use instead of when they go tax people them like what you say, tax people them na ferry junction or for cross $50. Why are you not making that money from EDSA, making use of an instrument, making use of an instrument or a machine or whatever that you were supposed to be making use of? You know they make use of them. They just need for draw small lights give you. Then they refuse for draw the lights give you. But then they all you property and they use them. And then you sit down, they talk, say waiting. And you say you are exploring solar options. Until then, what happens? The money that EDSA has been making on your head as a result of them having access to your machine, what has happened to that money? For how long? But make we left for the wicked we safe na that country dey, bo. Make we left for the wicked we safe na that country dey. Abdullah say it was lying. They are getting money from EDSA and did not want the people to know about. Well, we have no proof of that. We have no proof of the fact that until EDSA themselves as an institution come out and say every month now this will they give to the Ministry of Health as a result of us using their generator or their machine in Potloko, then we have a conversation to go on with. But right now it's his word against theirs. And if they're a credible institution and then don't they pay the ministry for the use of the machine, immediately I go make a press release, I go release a statement counteracting that fact. And then Peter Dauda gone to say, I think Minister Demby would like to share the generator with the 10th hospital in Potloko. I hear him say the generator is as big as a small house because we have long abandoned the idea of doing the right thing since, yes, we have. It no matter if the generator is as big as a small house. That is not the point. The point is principle. The point is accountability. The point is having proper structures in place. The point is having safeguard measures, stopgap measures. The point is having checks and balances. How you one minister go can sit down laughably, casually, they talk about something like that, like it's just that trivial. Listen, people. I therefore can't go people the event. I cannot go. I'm not go. It is forbidden for me to walk into a space where people are celebrating life. They are celebrating, happiness. They are celebrating success. They are celebrating everything that God has given to them and will continue to give them. And then I walk inside there with an upset face because these things do upset me quite a bit, honestly speaking, because I know the time that some of we will put inside salon even though we not do inside salon. I know the time, the hours, the commitment some of we will put inside salon even though we not they live inside salon. If we can divert some of that time to some of our own personal things, would be way advanced. And so when you hear such thing, it repulse you, it vex your spirit. They really vex your spirit. And so as a result of that, we tap the show I saw today. Go play waiting happiness status. Next week, we go pick and back up. We go listen to some more to waiting Minister Demby gets for say. Waiting some of the stakeholders they may say. And just like I analyze Minister Demby, now the same way we continue for analyzing and analyze everything will happen as status. Because that house is our house. Everything that goes on there, we have the right for saying I saw it for B or not to saw it for B. Because now we else. Ladies and gentlemen, until next week, may God bless we all. May God continue to provide for we all. I am sorry I have to cut the show short today as we go on and listen. But other commitments call, and I try for split me time into half. Uno thank you, and uno tata.
Amen. Amen. Distinguished guests, on behalf of His Excellency the President, it's my sincere privilege to welcome you all at this important high-level stakeholders meeting on the fight against Kush conveyed by His Excellency the President. As you would have seen on television and social media this morning, the President visited a drug rehabilitation facility at Hastings, where he listened with deep empathy to the stories of parents and victims. Therefore, this high-level meeting is in continuation of his leadership on the fight against Kush. Therefore, at this point, may I request that we do a quick self-introduction, after which our Honorable Vice President, who is the chair of the Presidential Task Force, to proceed with the rest of the meeting. We'll start with the Honorable Vice President.
Thank you very much, Dr. Mohammed Judu Jallo, Honorable Vice President. Good afternoon. My name is Alpha Sisi. I'm the Attorney General and Minister of Justice.
Good afternoon, Sheku Bangura, Minister of Finance.
Good afternoon, Dr. Austin Demby, Minister of Health.
Good afternoon, Mamusukume Morana, Deputy Minister of Basic Education, acting for the Minister.
Good afternoon, Maureen Langwo, Minister of Internal Affairs.
Good afternoon, Bakari Abdel Aziz Bao, Deputy Minister of Information and Civic Education.
Good afternoon, Ibrahim Sano, Minister of Youth Affairs.
Good afternoon, Melrose Cummington, Minister of Social Welfare.
Good afternoon, I'm Ibrahim Soisise, National Secretary General APA.
Good afternoon, Michael Tambakomba, Recovering Addict.
Good afternoon, Bendu Dasama, Presidential Advisor on Social Welfare and Inclusion.
Good afternoon, my name is Ansu Kone. I'm the Director of Mental Health and Psychosocial Support Services, Ministry of Social Welfare.
Good afternoon, I'm Andrew Jaya Kaikai, Executive Director of the National Drug Law Enforcement Agency and the Pillar Lead for Law Enforcement of the National Task Force.
Good afternoon, everyone. Yankuba Askebi is the name, Director General of Southern Port and Harbors Authority.
Good afternoon, I am Fodisa, the National Coordinator for Task Force for Drug and Substance Abuse and the Executive Director of the National Public Health Agency.
Good afternoon, Ansumana Mohamed Idris is my name, Director General Central Intelligence and Security Agency.
Good afternoon, William Fayaselu is my name, Inspector General of Police.
Good afternoon, Amara Haidar Bangra, Chief of Defense Staff.
Good afternoon, Abdullah Koka, National Security Coordinator.
Good afternoon, Yvonne Akisoya, Mayor of Freetown.
Good afternoon, Serafine Wakana, the UN Resident Coordinator for Sierra Leone.
Good afternoon, Wanchi, Chinese Ambassador, and also Dean of the Diplomatic and Consular Corps.
Honorable Dukabu, Minority Leader of the Parliament of Sierra Leone. Good afternoon.
Good afternoon, Honorable Matthew Sanyuma, Majority Leader of the Government Business House of Parliament.
Good afternoon, Honorable Ibrahim Tawakonte, Deputy Speaker of Parliament.
Good afternoon, Justice Kumbaka Manda, Chief Justice.
Thank you very much. Thank you, Your Excellency. Your Excellency, Honorable Ministers, distinguished ladies and gentlemen, first, let me, on behalf of the National Task Force, thank you, Your Excellency, for convening this high-level meeting on the fight against Kush. Distinguished ladies and gentlemen, honorable ministers, today we are here to provide His Excellency and stakeholders with the concrete action this government has taken since His Excellency instituted the National Task Force for Drugs and Substance Abuse. His Excellency, today we are here, like I just said, to get first-hand government interventions at various levels, from law enforcement, compliance, treatment, and reintegration, how far we have come. But His Excellency, this high-level meeting is coming at a time when there's an overwhelming call for renewed vigor to fight the Kush pandemic. So we are optimistic that this high-level meeting will no doubt signal a new beginning in that fight. First, I take this opportunity, His Excellency, to kindly demand that you provide an opening remarks, and then afterwards, we'll proceed with the rest of the program and come back to you with the closing remarks, Your Excellency. So.
Thank you very much. The Honorable Vice President, the Honorable Chief Justice, the Deputy Speaker of Parliament, ministers and deputy ministers here, the leadership of Parliament, the leadership of the security sector, leadership and members of the National Task Force for Drug and Substance Abuse, Your Worship, the Mayor of Freetown, the United Nations Resident Coordinator, distinguished guests. Today, we are gathered here not just to talk about a crisis. We are actually gathered here to defend a generation. We are here because something insidious, something dangerous, and something deeply personal has entered our homes, our schools, our churches, our mosques, and it's all over the streets. It is not just in the slums of Freetown or the corners of Potloko. It is in Bo, Makini, Kailan, Pujong, Bromth. It is everywhere in the districts. And it is called Kush. And it is tearing at the very fabric of our nation. In April 2024, I declared drug and substance abuse, particularly Kush, a national emergency. This was not symbolic, neither was it political. This was a solemn recognition that our country had reached a tipping point and we had to act. As at that time, the evidence was staggering. At our psychiatric hospital in Kisi, we recorded over 1,800 admissions in 2023, a 38-fold increase from a few years before. 59% of those admissions were linked directly to Kush. In Freetown alone, 12 young people were dying every week, according to the community and hospital reports. And across the country, teachers were reporting pupils that were collapsing during classes. Parents were burying sons in silence and in shame. When we looked deeper, what we found was even more frightening. Kush was not simply cannabis. It was and still is a deadly chemical cocktail. Lab tests revealed that this synthetic opioid is up to 100% times stronger than fentanyl, tramadol, animal tranquilizers, and even embalming fluids have been used. This was not recreational drug use. This was a deliberate poisoning of our youth. Once still, we discovered that this product was not created here in Sierra Leone. Data has shown that all the chemicals are imported into this country. This was not just a public health emergency. This was and remains a national crisis of identity, of hope, and of future. I could not and would not stand by while chemicals imported into this country consume the lives of our youth, who make up over 70% of Sierra Leonean population. Faced with this crisis, we did not wait. We acted. Under the leadership of the Honorable Vice President and the coordination of Professor Furisa, we launched the National Task Force on Drug and Substance Abuse to implement a multi-sectoral approach to combat this Kush crisis. Although Professor Sa will shortly provide us with a comprehensive overview of the progress made, let me share some key highlights of what have been accomplished so far. In terms of treatment and expansion, we have increased treatment beds from 50 in Freetown to 312 beds nationwide, a staggering increase of 524%. Health workforce, 1,247 frontline workers, including nurses, CHOs, social workers, and peer counselors, have all been trained in addition to care and mental health. Community engagement. The task force has reached over 1,186 communities, distributed 10,000 information, education, and communication materials, and trained over 1,000 youth and women leaders as champions. Reintegration support. 198 young people reintegrated into schools, vocational training, or small businesses. Law enforcement. Over 3,800 arrests have been made. Drug warehouses dismantled and key supply routes disrupted, especially in the western area. As President, let me be very clear that despite the progress made and our actions, the fight against Kush continues. What more can we do to raise awareness, promote healthy alternatives, and deter drug use among our youth? Second, concerning care and treatment, how can we expand access to care, treatment, and rehabilitation to effectively meet demand? Third, with respect to social support, we need to scale up our counseling, skills training, and reintegration programs to support individuals in recovery. as there are gaps remaining that we must urgently address. Fourth, in terms of law enforcement, what additional measures are required to boost investigation, arrest, and fast-track prosecution to disrupt the drug supply chain? And finally, on community engagement, what more can we do to revitalize our methods of engagement that address local needs and create sustainable impact? These questions must guide our reflection today as we renew our commitment to overcoming this fight. With these opening remarks, I look forward to constructive deliberations. Thank you very much, ladies and gentlemen.
Thank you very much, Your Excellency. We want to thank you for those opening remarks. And I believe that those remarks have set the stage for the high-level meeting. And on that note, I want to give the opportunity now to the coordinator of the National Task Force to give us an overview of the progress and presentation of the report. National Coordinator, Professor Sam, you have the floor.
Thank you very much, Honorable Vice President. His Excellency the President, Honorable Vice President, all protocols duly observed. Giving a brief account of what we have done since the establishment of the task force. Kush, we all know, is not marijuana. It is a deadly cocktail, as already highlighted by His Excellency, involving marshmallow, nitazine, which is 100 times more fatal, or 100 times more potent than fentanyl, tramadol, and other unknown substances. It is lethal. It is cheap and it's spreading very fast. Kush is not a Sierra Leone problem. It is a West African problem. It is an African problem. Currently, West Africa is considered as the hotspot for synthetic opiates. The graphs that you see, these are just seizures of contrabands across the West African sub-region. You can see Sierra Leone is way down for seizures of by country. Benin, Guinea-Bissau, Cape Verde, the Gambia, Senegal, they are all ahead of Sierra Leone. And for heroin also, same. Sierra Leone is way down. Liberia tops the list. We have Benin and we have Cape Verde and other countries. Where are we? There has been a significant rise in admissions, as already highlighted by His Excellency the President, from 2020 to 2023. We had 222 admissions at the psychiatric hospital in 2020, and by 2023, that number has increased to about 2,955. Notably, there was a 3,868% surge in Kush use that was recorded at the KC Psychiatric Hospital. Hence, His Excellency the President declared Kush as a national emergency and a security threat in April 2024. When the task force was formed, it was meant to address an urgent need of an epidemic. 5 pillars were clearly established, and that was the organogram that we are working on. The task force reporting to His Excellency through the Honorable Vice President, and we had strategic pillars. Indeed, our approach was a whole of government model. That is, all MDs involved, as you can see from the slide. There was a national structure, and we established district structures, and those district structures were replicated at community level. These are the strategic focus when we were established. The first one was to raise awareness and promote healthy alternatives. The goal set by His Excellency the President at that time was to reduce youth drug abuse by 80% within the first 2 years. Another goal set was to train 100 community leaders in drug and substance abuse within 6 months. That was realized. The next goal that was given us was to achieve a 70% increase in conviction of Kush-related offenses within the first 1 year. We are also tasked, that was a little overambitious, to establish 1 rehab center in each of the districts because it was an expensive exercise, but we came together as a task force and then recalibrated that why can't we start at regional level and then can cascade to district level. So that is what we have done. And then we are also tasked to provide 90% support to individuals who were to return to work or to education. These are the strategic pillars. Prevention and community engagement. Their main strategy is risk communication and community engagement, is to increase public awareness campaigns and to educate the public on drug abuse, especially Kush. And the lead for the prevention pillar is the Ministry of Information and Civic Education, the co-lead Ministry of Health and NPHA and other organizations that are part of it. Community engagement is led by Ministry of Local Government, and the co-lead is Ministry of Youth and NPHA and other organizations. Then treatment and care is to provide medical care for substance abuse victims. Ministry of Health leads that pillar, and then we have co-pillars, Pharmacy Board, National Public Health Agency, and our development partners. Social support, head by Ministry of Social Welfare, Ministry of Youth is co-leading that pillar, and Ministry of Labour and other organizations, organization development partners, and law enforcement. Law enforcement is to disrupt the illicit drug supply chain with investigations, arrests, and prosecutions. NDLEA leads that pillar, and then the other members of the pillar, Ministry of Internal Affairs, the Ministry of Justice, Ministry of Defense, OMS, and other development partners. Additional pillars that can be established, and we did establish them, was to cross-cutting strategy, surveillance, and using the 117 to call, and NPHA, Ministry of Health, Social Welfare, our universities inclusive, and safe and dignified burial. That is the cross-cutting strategy, and to ensure safe and dignified burial, Ministry of Health was leading, Ministry of Internal Affairs, Freetown City Council, and our development partners. Fortunately, I think there was a meeting yesterday, Ministry of Local Government, Ministry of Health, and Ministry of Internal Affairs. So this slide might be redundant. I think they came up with something that supersedes what we propose, what we are proposing. Now we take pillar by pillar. The treatment and care pillar, as I said, led by the Ministry of Health. The total number of cases seen by the at the Kisi Psychiatric Hospital or by the team from the establishment of the task force is 6,839. And of those, 2,324 Kush victims admitted at the psychiatric hospital. And then the treatment pillar was able to train 1,247 health workers to assist in that venture. And a lot of clinical protocols were developed. Rehabilitation and integration pillar, head by Ministry of Social Welfare. Ministry of Social Welfare has effectively established 3 rehab centers, one at Hastings, which has actually graduated about 5 cohorts of victims. One also established at Daru. We have graduated 1 cohort, and then 1 cohort has now been inserted at Daru, and Makeni is on the way. We send resources to Makeni back and forth, but we have now found a way to make sure that we circumvent those obstacles that we are facing in establishing the outfit in Makeni. And then provided psychosocial support for over 4,000 former drug victims at a one-stop center established by the Ministry of Social Welfare. And over 1,000 youth leaders have been integrated as peer educators in youth clubs, and the rehabilitation of over 400 victims in government of Sierra Leone established rehab centers that has been established. Prevention and awareness pillar, led by Minister of Information and Civic Education and Minister of Health. They have produced and disseminated jingles in 6 local languages. They have produced over 10,000 IEC materials with animated videos, and these have been developed and shared widely within the social media. Television and radio talks have been held on drug-related issues with experts, community leaders, and survivors, and the engagement of journalists and bloggers and CSO representatives. Community engagement pillar. This is led by the Ministry of Local Government. That pillar held regional stakeholder campaigns involving paramount chiefs and community leaders, and then over 1,000 community champions have been trained, involving youth groups, women leaders, to lead local prevention and rehabilitation efforts. The community-led approach was used, and this has been rolled in 20 hotspot communities across the Western area. And prevention and awareness campaigns launched in 50 schools and 3 public universities. And the sensitization session has reached over 25,000 pupils and students. Community engagement, over 1,000 champions have been trained, 42 local advisory groups formed, and then 30 dialogues held across the country. Law enforcement. Law enforcement has conducted over 170 raids. Within the last 5 days, the law enforcement pillar has conducted raids in about 29 hotspots across Western area, and over 50 arrests made during this time. And then the destruction of impounded narcotics have been done at Toko. These are some of the areas that they were engaged during the past 5 days. And this is going to be a sustained effort for the next 2 weeks. Call to action. What do we want to? We are asking for a sustained investment to the response efforts. We are asking for a revision of revision and enforcement of existing laws. The law enforcement pillar to identify and disrupt the supply chain, because it's like it's like if you are mopping the floor and there's a tap upstream. If you don't close the tap, you continue mopping for the rest of your life. So if the supply chain is cut, then we'll succeed in the other pillars. We want to establish additional rehab centers, and the ministries to consider reallocating resources, manpower, and programming to effectively support the task force, and to intensify school, university, and community outreach programs, and treatment and care to commence outreach programs, because you can see over 4,000 people were actually reached. So we are thinking of establishing outreach programs for that pillar. In conclusion, we need everyone on board, government, the community, and partners, to collaboratively tackle the Kush crisis. Your continued commitment and flexible strategies are essential to achieve and maintain our long-term goals. We are prioritizing and supporting community-led initiatives as they are fundamental to driving sustainable change. We need your feedback on our proposed approach. I thank you.
Thank you very much, Professor Sir. Your Excellency, you've heard and seen the presentation. It captures the progress that have been made so far, and also gives a vivid picture of the various interventions from law enforcement, compliance, treatment, and reintegration. The report also captured where we are, the facilities that have been established, and the additional facilities that are in the pipeline. On that note, Professor, can you please hand over the report to His Excellency? Can you please move forward and hand over the report to His Excellency, please? Thank you very much. Your Excellency, as you can glean from the presentation, you realize that the critical arm of government, which is vital, if not, I would say, the backbone of the fight against Kush, which is the criminal justice arm, was not overwhelmingly captured. So as a result, we want to give opportunity to key institutions within that chain, and also the House of Parliament, that is also critical. You must have heard about the call for action that was clearly highlighted in the report. What additional support that the task force need, what additional directives that the task force is looking up to. So on that note, I will give 4 key institutions 5 minutes each to just make a very short intervention. I will start with the Inspector General of Police, who will just talk on breaking the supply chain. Inspector General, you have the floor.
Thank you, Honorable Vice President. Your Excellencies, our distinguished guests. As part of the law enforcement team, we have made some contributions in the efforts to fight Kush. In the first place, we are conducting sustained raids at all levels. When I say at all levels, it involves divisional level and even at the regional level. And during these raids, we are making quite a number of arrests. These arrests we are investigating and charging to court. Secondly, sir, we have a lot of activity at the quay and at the airport and at the border crossing points. So in all of these 3 positions, we intercept, we seize, we search for drugs and other precursor chemicals which are used to make synthetic drugs. And this one has led us to actually reach out to internal conspirators. These are people who are working within the cargo supply chain, and these ones facilitate the distribution of these drugs in this country. For example, most times at the quay, when we intercept containers, we search, we have people who come forward to actually to clear these containers. These are clearing and forwarding agencies. But these ones, most times when we investigate them, they are let off the hook because we don't have the provisions in the law to capture them. And then, thirdly, we do investigations. When we arrest, we investigate and charge to court. To facilitate the investigation, what we have done, sir, we used to have only 1 forensic analyst, but recently we have trained 6 of them. They are deployed in all regions in the country, and we have introduced the UNODC field test kit, which is simply chemical reagents which indicate the presence of an illegal substance by simple color changes. So now the issue of having to take long time to have suspects in custody before they can be charged to court has been eliminated. So we're also collaborating with other actors in the field. We do community engagements, we sensitize schools, we go out in the communities so that we tell them about the dangers of drugs, and we tell parents to also pay attention to their children for them to stay out of drugs. And sir, what is expected also when we arrest and charge the court is to disrupt the financial flow. This is disturbed when we seize assets and funds associated with drug trade, so that helps us to collapse the economic foundation of the drug trade. So Your Excellency, Honorable Vice President, as part of the law enforcement pillar, these are activities we do on a daily basis. They are sustained. They are not a one-off activity. So on this note, I want to end my presentation in this way and make a commitment that we as the SLP will continue to sustain our operations in this fight against Kush. Thank you very much, sir.
Thank you very much, Inspector General of Police. Now I will give the Attorney General and Minister of Justice the floor to deliver his statement.
Thank you, Honorable Vice President, Your Excellency, distinguished ladies and gentlemen, good afternoon. Thank you for the opportunity to make brief remarks here. Your Excellency, distinguished ladies and gentlemen, in response to the escalating crisis posed by the proliferation of synthetic drugs, particularly the substance known as Kush, the Office of the Attorney General and Minister of Justice joins His Excellency, who is leading on this, to reaffirm our unwavering commitment to the rule of law and the protection of public health and safety through robust prosecutions. Your Excellency, sir, the Director of Public Prosecutions under the directives of the Attorney General and Minister of Justice has now assumed a central role in leading the prosecution of all drug-related offenses, including those involving Kush. This strategy shifts from police-led prosecutions to state council-led prosecutions. This was necessary. This was necessitated by the wide-led concerns over procedural shortcomings in the handling and prosecution of drug cases at the magistrate court. Your Excellency, we in the Office of the Attorney General and Minister of Justice have identified 5 strategic pillars to inform the response of the office. One is centralized prosecution oversight. All Kush and related cases are now under the direct purview of state prosecutors across the country. This is done to ensure consistency, legal rigors, data collection, and accountability in the prosecution process. Through the swift and fair trials, we will strengthen systems to expedite the judicial process for drug offenses, ensuring that justice is swift and fair. And 3, continuous collaboration with law enforcement and other agencies will strengthen coordination with the Sierra Leone Police and the National Drug Enforcement Agency to ensure that prosecutions are informed by quality investigations, accurate forensic evidence that align with prosecutorial needs, and execution of court orders. And 4, capacity building. We're investing in capacity building for prosecutors. We're doing this both in-house and then, of course, also sending prosecutors abroad for professional training, so that we can have expertise in clandestine laboratory and forensic examination processes to ensure that we strengthen prosecutions. And then 5, we're pushing for legislative reform. We actively engage in reviewing and recommending updates to existing drug laws to reflect the evolving nature of synthetic drug threats and strengthen prosecutorial tools in the country. Your Excellency, we acknowledge that we need to do better. We know that we have had to deal with several challenges, including limited resources, case backlogs, threats to witnesses, and evolving criminal tactics. But we're in discussions on how to respond to these challenges. We want to join you and others to say that prosecution alone cannot prevent the importation, the manufacturing, and transportation of Kush and other dangerous drugs. But we all need to work together, coordinate our efforts, and ensure that we bring this crisis under control. Thank you very much.
Thank you, Honorable Minister. I want to thank you for that intervention. I will now give the floor to the Chief Justice for his statement.
Thank you very much, Vice President. Your Excellency, the President, distinguished ladies and gentlemen, all protocols observed. As an arm of the state, primarily responsible to interpret and enforce the law with a view to making sure that there is peace, stability, good governance, and the rule of law, the judiciary is committed in making sure that we fight this menace. I shall not bore you with the functions of the judiciary, but rather to state the steps we have already taken in our bid to combat this scourge. We have appointed a specific number of judges and magistrates throughout the country to expeditiously deal with drugs and drugs-related matters, while plans are at an advanced stage to establish a special court for drugs and drugs-related matters. I have directed judges and magistrates to extend court sittings to include Saturdays. While a comprehensive practice direction will be issued soonest, I have issued the following directives to all judges and magistrates dealing with drugs and drugs-related matters. 1, no bail shall be granted to defendants charged with drugs and drugs-related matters. 2, no long adjournments shall be entertained when dealing with drugs and drugs-related matters. High sentencing regime will be enforced for those found guilty, particularly for manufacturing, transporting, and the like. During the process, only very few, during the trial process, now only few samples will be kept, while an order will be made for the immediate disposal of any stockpile in the presence of all the relevant key holders kill players after it may have been tested to determine the quality and quantity. More stringent monitoring mechanisms have been established to include the Chief Justice and 4 senior judges and the masters and registrar to monitor the proceedings as regards all the drug matters presently in our court. There has been a clear line of communication between the Attorney General, the Director of Public Prosecution, and the leadership of the judiciary to address the bottlenecks and challenges in dealing with drugs and drugs-related matters. Your Excellency and all stakeholders present, I shall not bore you with all the steps we have taken with a view to making sure that we bring this menace to an end. Rather, I shall give assurances that the judiciary is ready, able and willing to play its own role to enforce the laws to the latter in our collective efforts to obliterate this scourge. I thank you very much.
Thank you, Honorable Chief Justice. I will now give the floor to the Deputy Speaker of Parliament to make his statement.
Thank you very much, Honorable Vice President. Your Excellency, the President, I seek your permission to continue on the existing protocol. As Parliament, it is clear that our principal responsibility, accompanied by my two leaders, the leader of the opposition and the leader of government business, is to make law. In Section 73, we are the supreme law-making bodies of Sierra Leone, and in Section 105, we are responsible to make law for the peace, stability, and good governance of Sierra Leone. It is our utmost responsibility to support the government of the Republic of Sierra Leone under His Excellency's direction, and we have done that severally. In 2008, Parliament enacted the National Drug Law Enforcement Agency Act that set up the National Drug Law Enforcement Agency. In 2024, during the passage of the state of emergency, the declaration of the state of emergency pursuant to Section 29(5), His Excellency requested us to support the fight against this scourge, and we did. We displayed pictures, evidence of how Kush is affecting our nation. Kush is seen by Parliament as not only an attack on the development of Sierra Leone, but it's also seen as an attack to the human capital of this country. So as Parliament, we shall be dedicating a day for a motion to be moved by the leader of government business, seconded by the leader of opposition, wherein members of Parliament would engage in a debate, sensitization to the public. We shall also embark on getting our members of Parliament to go to their various districts to engage the community and to be involved in the community pillar so that we can sensitize our people, because we represent them and we see it as our primary responsibility. In terms of the review of the NDLA Act, we're ready when once an amendment, a repeal or replacement is brought to us. We are ready to amend the first, second, and third schedule of the Act so as to list some of the concoction that they use for the production of Kush, whether they can be listed as banned substances, high-risk substances, or controlled substances that can only be imported by a specific group of people. So, Your Excellency, it is our utmost responsibility as Parliament to support this government and to support our people, because what is happening is undermining the very development that Your Excellency strives to bring to our country, and we see it as an affront to us as a country, and are ready to support you. Thank you very much.
Thank you very much, Honorable Deputy Speaker of Parliament. Your Excellency, you've had the presentation and the intervention of the criminal justice arm, including the demonstration of the readiness of the House of Parliament to support law reforms in the event that that is on cause. Your Excellency, we want to end the interventions with a testimonial that will be given by Mr. Michael Tambakomba, Mr. Michael Tambakomba, was a victim, a Kush victim, and today is a champion in his community and in the western area to fight against. So we want to give him that opportunity to tell his stories, and then before we come to a closing remarks. Mr. Komba, you have the floor.
Thank you very much, Honorable Vice President, and thank you again, His Excellency. Thank you, distinguished guest. My name is Michael Tambakomba, a recovering addict from all this type of drug in Sierra Leone, being Kush, Tramadol, Ecstasy, and Flex. I started taking Kush 2016. By that time, it was called Colorado. We normally bought that one 145, 150 on a sachet. I've been part of the Republic of Alslav football team, played for them for 3 seasons. Then I ended up signing a contract in Liberia after some disappointment, depression. Then returned back to Sierra Leone and involved into this drug. I've been into drug for more than 5 years, but thank God for today. I'm 1 year, 2 months clean. So I normally use my testimony, going out, explaining to my fellow youths, my brothers and sisters, that it's possible and recovery is possible as well. They can use my testimony to overcome drug abuse. And again, I want to say a big thanks to the director of NDLA, Mr. Samuel Duba. He has been like a father to me, because anytime I have a difficult situation, if I try to collect a boy from the slum with saw, he would do the referral for me to take the boy to hospital. And I've started my charity foundation, which is Kickstart. It's a way of expressing and sharing my testimony for them to know that there is a chance and there is a way, and you can live a better life without being involved into drug. I just want to say thank you.
Well, thank you very much, Michael Tambakomba. Your Excellency, you have had the presentation and the report, the progress report has been handed over to you. We have also had your call on what we can do better. The various interventions so far, starting from the report, has given us a stock taking of how far we have come, and then the necessary call for action. We have heard from the law enforcement the steps that have been taken to disrupt supply route and the ongoing work. We have also heard from the Attorney General and Minister of Justice the ongoing work that is taking place within that ministry to support the fight against Kush. The Chief Justice, the Honorable Chief Justice, have given us some concrete steps taken by the judiciary to fast-track drug-related cases. And we also heard from the Deputy Speaker of Parliament demonstrating the readiness of Parliament to work with stakeholders and various institutions to fast-track legal reforms. And we have ended that with a testimony from our brother Michael Tambakomba, how far he has come with his own personal fight against Kush, and then his community-led actions. Your Excellency, at this stage, from the various interventions and report, we realize that there is a need to overcome the challenges with regard to prosecution. We have also had the need to address the issue of dedicated funding and also the challenges resulting from cross-border control. We've seen the progress that have been made at entry points, but cross-border trade and porous borders continue to pose a serious challenge. Your Excellency, I want to assure you that with your support and additional directives, we will win this fight. Given all the presentations and the intervention, Your Excellency, I will now ask you to deliver your closing remarks. Thank you very much, Your Excellency.
Thank you, the Honorable Vice President. As we draw this critical high-level engagement to a close, I've listened to the presentations and the interventions, and they show that we are confronted with a very profound urgency. The efforts we have made so far and the challenges should deepen our resolve against the scourge of Kush and all forms of drug and substance abuse. In light of your valuable contributions and the urgent need to strengthen and accelerate our response, I therefore announce today the following decisive measures. First, a special fund dedicated solely to supporting the 5 pillars of our fight against Kush shall be established. This fund will ensure that our strategies from prevention, care and treatment, social support, law enforcement to community engagement are backed by sustained flow of resources to fight against Kush. Second, to bring swift justice to those who exploit and destroy lives through drug and substance abuse. A special court shall be created. This court special security unit drawing from personnel from both the Operation Support Division of the Sierra Leone Police and the Republic of Sierra Leone Armed Forces. They shall intensify full-scale raids targeting drug peddling hotspots within our communities and effecting on-the-spot arrest. Fourth, it is hereby recommended that a new practice direction shall be developed It demands parents recognizing the warning signs and acting swiftly. Teachers watch attentively over our students. Communities protect one another vigilantly. Religious leaders promote messages of healing, not stigma. Businesses extend opportunities through internship and jobs for those in recovery. Development partners deepen their support. The judiciary holds traffickers and dealers accountable. Parliament enacts stronger punishments, and every Sierra Leonean declaring family not in our country, not in our communities, not in our homes, and not on our streets. This by the language we all can hear even at Creole. For say, this not a blame game. This is not a direct threat to national security, and it targets we young future. We picking them when we don't say not them. We the train and men for me to take care of we and the future of this country. So I invite every Sierra Leonean, in addition to the support we get from the police them, the soldier them, the health workers, Ministry of Social Welfare, and also the social workers them, for now all join and fight this fight. If we not fight this fight, it will make this country not go before. And let me say this at this juncture: any public official, whether at the police, airport, seaport, or border, found colluding with traffickers will face the full force of the law, and there shall be no sacred cows. Let this be our rallying call. Together we can overcome. Together we can combat the scourge of Kush. Together we will build a healthier, safer, and brighter Sierra Leone for all of us. I urge each one of you to carry this commitment beyond these words, to act, to speak out, to protect and to preserve. The time is now. Our future depends on it. And to the families and friends mourning the loss of loved ones to Kush, we share your profound grief and sorrow. As a government, we stand in solidarity with you. And for those loved ones who are affected by Kush, we hear your concern and anxieties. Through the strength of our pillars, as you've heard, we are committed to ensuring that care, treatment, and social support are accessible to all who need them. May our collective efforts bring hope, comfort, and restoration to every affected family and community. I count on all of you to work concertedly to implement with immediate effect all the new measures that I have just highlighted. I thank you all for your attention.
Your Excellency, on behalf of the team and the guests at this high-level meeting, I want to thank you very much. Your Excellency, we are optimistic that these new directives capture today some of the key challenges that we have had across the various presentations and interventions. The directives to establish a special fund to scale up so that there is a sustained flow of resources is key. The swift justice measures, particularly the creation of a special court, and also the establishment of a special security unit to intensify the scale. His Excellency, finally, I must say, the new call for continued community engagement and community action is key. Distinguished ladies and gentlemen, we have heard His Excellency, we have sensed his passion, we have seen and heard the additional directive moving forward with regards to funding, law enforcement, prosecution, and more importantly, its call for community and national responsibility. Your Excellency, on behalf of the High Table and all the guests and those institutions that have made presentation, I want to assure you that with these additional directives, you have given a new arm and renewed vigor and life to the National Task Force. We will work with the respective stakeholders to ensure that we follow through on this new directive, and we are optimistic that this is going to signal, like I said before, a new beginning in the fight against Kush. Your Excellency, distinguished ladies and gentlemen, on that promising note, I want to hand you over to the Press Secretary as we have come to the close of His Excellency's remarks. Thank you very much.
Thank you very much, the Honourable Vice President. Please rise for the departure of His Excellency the President.
But telling you that it be, if you pardon a smoker, you safe na smoker. If you pardon a drunker, then you safe na drunker. But if you pardon well intelligent and matured, you are going to think for a brighter future. So let me say no to this. Let me say no to.
Sierra Leone, Kush, you ma killer this is for them. Hope for you, sir.
Say not a Kush, no, not a Kush, no, not a Kush. Oh yeah, I can feel them. What are they on me eye? We are the see me sister them, they die in the street. Oh. I can feel them when they see me brother them na streets, yeah. Some they link they not, some lay down a guts at the sleep, oh. So when I ask them, tell me say na Kush, na keep pull roll and son of them food. They prefer for left the house, them gonna get so all day they Kush, oh yeah. Say not a Kush, oh. Me brother don't want before him them. Say not a Kush, oh. So we they use the all youth them just a dry. Say that's a cushion. For your salon, we say that's a cushion. Hey, push for die. Say that's a cushion. Papa government help we are. Say that's a cushion. Hey, push for die. Say that's a cushion. Hope for youth say. So we say make we drive Kush na salon, but we life them.
That is so right, yeah now. What if they do? What we bother them, they die. Push them down the hill, now them body just they dry. So foot at them body, they and now they just they cry. Now we bother them foot so they swell, now why? I don't know if now the chemical or what's in then they put. Best of all avoid them, nothing but the suit. Other food and they for it, come up young Kush. We say bring this message so you do work for you.